Today, we are going to discuss the classical radiological findings of osteoarthritis, which is very often asked the long cases, short cases, and many times in a static OSCE and MEQ as well. It is so commonly seen. We'll be discussing more about the knee because knee osteoarthritis the most common findings that we see in the patients. What are the views that is required to understand the osteoarthritis of the knee? The radiographs of the knee must be obtained when the patient is standing. And why a standing view is necessary? Because by taking an X-ray when the patient is standing, the joint space narrowing can be visualized in the most physiological condition. It gives an accurate representation of the joint space narrowing which is present in the patient when the patient is walking. It also gives the degree of deformity in the knee, which becomes very apparent when the patient is bearing weight on the knee. And it will also give an overall alignment of the lower extremity, like an X-ray when the patient is standing. What are the other views that can be taken? There are other views which is called sunrise view, also called axial view, and many call it as skyline view, and sometimes PA view in 30 degree of flexion is also asked for. So this is the PA view in 30 degree of the flexion that we are seeing on the left side, and this is sunrise view where the patellofemoral joint space is very nicely seen. One must remember that the films taken when the patient is lying down supine gives a false sense of joint space and also the alignment, and it should never be accepted. It is not used in the evaluation of any suspected case of osteoarthritis of the knee. So what could be the characteristic findings? Joint space narrowing will be seen, osteophytes will be seen, hibernation of the bone, also called subchondral sclerosis. There will be or maybe subchondral cysts. There may be varus deformity. There may be loose bodies, and in extreme late cases, there can be subluxation. Decreased joint space is due to the loss of the height of the joint cartilage, and it affects medial joint space mostly. The osteophytes are usually seen at the articular margins. They are supposed to be due to capsular traction forces. Subchondral sclerosis is usually seen on the pressurized side, that is, on the side of the decreased joint space. This also usually on the medial side. It is due to the bony response to increased stress. Subchondral cysts, again on the pressurized side it is seen. It disappears once the weight is removed from the pressurized side. The loose bodies could be either of the bone or it could be of the cartilage. Varus deformity is usually seen, and it is due to the degeneration of the cartilage on the medial side. This is the normal joint space of the hip, and this is abnormal joint space, meaning it is decreased, almost not seen. Let us see in the knee, it is on the medial side, the joint space is almost nil. You can see it in the patellofemoral joint. This also joint space is decreased. The osteophytes are usually seen on the articular margins on either side. So you can see it on the medial side. This is osteophyte. Here in the hip also we can see osteophytes. This is the bigger one, and sometimes we'll be seeing the subchondral cysts. Subchondral cyst just below the joint margins. This is the cyst we are seeing. Here also we are seeing cyst. Now in the hip, it is very clearly seen here, multiple cysts. Here again, this is very clearly being seen cysts. Loose bodies, see the loose bodies, and here there are multiple ones. The varus deformity, see the longitudinal axis of the femur and longitudinal axis of the tibia, actually it should be a little of the valgus. Now it has become varus. And subluxation, we can see there is a subluxation of the joint. This tibia has shifted laterally. Again, this one also subluxation is being seen, and there may be an extreme subluxation. See subluxation and presence of periarticular bone formation. Thank you very much.